Hello, Pat Zemer here with MagnaWave. Welcome to this Tuesday edition of MagnaWave Office Hours. We come to you every Tuesday as often as we can to answer any questions you may have about PEMF, MagnaWave, training, machines, whatever it is. We'd like to answer those questions and make sure that you have all the information that you need. So first off, share this program with your friends so they can join us and have their questions answered as well. We look forward to answering as many questions as we can throughout the program. So if you will, share this program with your friends, and then we can have more people join us and have more fun. If you'd like to talk with me, send a text to 502-599-9722, and I will promptly call you back, and we can have a deep discussion into whatever it is you want to talk about. I love to do that because we often go a lot deeper in our responses. Instead of you asking a question online, and then I go to the question and I give an answer, but there may be some ancillary things that you want to talk about. So when we're on together, we can talk through some various issues and go a little deeper into our conversations. So send me a text, 502-599-9722, and I will give you a call back and we can visit. So it's always a lot of fun to do that. Let me come over here and see Tracy's with us. Becky's with us this morning. Great. Thank you for this today. It's morning in California and it's noontime on the East Coast. So wherever you happen to be, we're glad you're here and we look forward to visiting with you at that time. Kathy, good morning. Emily's with us as well. So I come back here. There's a couple of things a couple of comments we received and some questions that people have. Amy writes that I MagnaWaved a dog today that I used to pet sit. I haven't seen him since December due to the new baby in the family and mom taking time off to work with COVID. He's aged a lot since then and has been struggling with a lot of arthritis pain to the point where he sometimes struggles to get up and he doesn't really play anymore. She did a 25-minute session on him early this afternoon. It would be yesterday, early this afternoon, and just heard from the owner when they took him out to potty a little while ago. He started racing around the yard. Then he did a full-out Superman stretch with front and back legs stretched all the way out. That's always exciting. She said he hasn't done that for a long time. Her husband looked at her and told her to book me for weekly sessions. That's a good deal. So we always like to hear those kind of comments. And if you have any comments about that or questions you'd like to ask, please chime in and we'll certainly answer or discuss any of those questions that you may have. There were a couple other questions. Let me scroll down here and see. Audra writes, boyfriend broke a metatarsal bone in his foot about 6 weeks ago and have been using the semi on it as much as possible. Waited about a week after surgery. He just went to the doctor today and still has inflammation between the break. We haven't treated him for about a week due to being out of town. Should you keep treating or lay off? Well, if there's still inflammation, you want to keep treating. And the problem with the foot, it's like breaking a bone in your hand or something like that. You're still doing it. Even if they put you into a boot, you're still walking, you're still moving the area. So it's a lot harder to get at those types of situations. Treating as often as possible is a good thing. In that type situation, I would probably treat sometimes, if you can, twice a day for 10, 15 minutes maybe. And so I would do it more if entirely possible to do that, because again, as you move, you continue to irritate the situation. That's like someone having a spur on the bottom of their heel or the bottom of their foot. And unless it is removed, scraped off, removed in some fashion by a podiatrist, all we can really do is relieve the pain, relieve the inflammation around the area. But as soon as you begin walking, that spur is once again going to start pushing on the tendons, the cartilage, the muscle, whatever it may be, and that irritation will most probably return. With a break, like this gentleman experienced, again, it's just going to take some time. I would do more. In this situation, if he had a break, I would treat as quickly as possible to get after that type situation. We quite often talk about waiting when we're treating horses for broken bones and things like that, because we don't want to create a false positive when they go back and x-ray or check the break at a later time, because quite often these situations go from we want the bone to begin to heal from the inside out. We don't want to have it to look like, oh, look at it, it's healing up, but it's not healed all the way through. And someone says, oh, look, it's good and solid, it looks great, let's go back on the track. No, too soon. So we like to wait when we're dealing with animals. So when we come back at a later date, we get a good start. The bone starts to heal the way it's supposed to. And then we simply, with our improved oxygenation, improved blood flow, cause that healing to continue from the inside out. That's the goal when those types of situations occur. On a person, we know, you understand when you still have pain. Again, a horse doesn't necessarily tell us when he still has pain until it gets so far that they're down or they're having a problem. So with a person, if it's broken and you can get on it pretty quick, go for it. Help your husband or your boyfriend's foot potentially heal more rapidly. Not that waiting a week is a problem. That doesn't cause it to take much longer to heal or anything like that, but you can start a little sooner as you approach those situations. Always talk with your doctor. Get your doctor's idea on what you're doing. Keep them abreast of what's going on so you can then proceed accordingly. But keep treating, and I would treat as often as possible when you have that situation, those types of situations that you're going to continue to use or have issues with. Does the MagnaWave app have an ETA of when it might be back up? Well, Chris is with us. Perhaps Chris can give me some indications and put something in the chat box there, or it's pretty soon, right? Or is it up? It's up. So it is up. Now, if you're having trouble getting into it, you may have to change your password. So if you're having trouble getting in or it's not showing for you, simply click lost password or forgot password and then establish a new password. If you continue to have trouble, send an email to support@MagnaWave PEMF and we'll get in it and get on it and get right back to you. You could also send a text to or send a message to Teresa at MagnaWavePEMF.com or Aaron at MagnaWavePEMF.com, and we'll certainly do our best to get you up and running as soon as possible with the app that you might be using. Let's see if there's any questions here that have come up. Let me come over here. Kate's with us. Carly's with us this morning. Good morning from Sandy. I hope all is well. We've got several people with us this morning. We're also on Castbox, as you know we are each week, which is a radio version of this particular broadcast that you can listen to while driving or on your phone if you don't want to use your bandwidth for video. So, and we've got somebody that wants to visit, so we'll check that out here. Let's open it up here. And I have a question, so let's bring this person up. Voice call. Okay.
Hello.
Good morning.
Good morning. How are you doing?
I'm doing good. How are you?
I just have a question on a protocol. I have a client who has a mule she's adopting a mule who was in the fires and got burned about 75% of the body.
Wow.
But he wants me to really work on his face that got burned. What would be a good protocol? Would it be the butterfly loop, the large loop is hanging?
I would think that the large loop is going to cover more area of the mule's face, and basically you want to certainly make sure it's comfortable. But I would simply place the large loop around the face, maybe move it a couple of times, and to cover as large area as possible. Now, if the burn on the face is smaller and it's kind of limited on its size or space, you could use the butterfly. That would be fine to approach it with the butterfly. But I certainly think the large loop would be the most appropriate. You could take the wings and do the whole head pretty much. If you use the wings and draped it over the top of the head, then held it at the muzzle or at the nose, and from that perspective, you could use the large wave wings as well and cover a lot of area. You could almost drape the wings, put them up over the head, and put it on each side of the face if you had the large wave wings.
Okay, perfect. That answers my question.
Okay, thank you so much.
Thank you.
Have a great day. Bye-bye. Great question about a mule that was burned. I'm having my microphone wasn't working this morning since I traveled. I thought it was charged up, but it's not. So I'm using the mic on the computer, and I hope that works out okay for us to do this. It will. That's what we used for a long time all by itself. But make sure that you speak up when you call. But if you'd like to visit with me, 502-599-9722, and I will simply give you a call back, and we can have a conversation about what it is you're doing. And in that case, which I shared, you want to cover as much area as you can so you get the result that you're looking for. We have another message from Deb. Let me get Deb on the phone. Here we go.
Hello.
Hello, good morning.
Hey, it's Deb Cottingim.
Yep. How are you?
Yep, I'm good.
Great.
I'm watching live here too, so
Yeah, there's a little delay. So
Gotcha.
Yeah, there is a delay.
Okay.
So we're live
right.
to you and I, but everybody else is
Perfect.
on a little bit of a delay.
Perfect. My question revolves around 2 weeks ago today, I had a pretty significant back surgery. I am loving my MagnaWave, as I knew that I would. And I spoke with the surgeon before the surgery and told him what I do. You know, this is my business.
Right.
And that I have every intention of using this after. He was okay with that. He doesn't really know much about it,
Right.
but he was okay with it. My question really is, can I overdo this? I'm using it probably 3 times a day. I have the mat, which feels absolutely wonderful. And so I'm using it about 30 minutes in the morning, 30 minutes in the afternoon, another 30 minutes in the evening. Is it too much?
Well, I wouldn't say it's too much. I don't know that you need all 3. Now, if it's comfortable and you're feeling good and you want to do 20 or 30 minutes, that's okay. The biggest risk you're running is you could over detox yourself if you're doing it every day, because this does serve to help detox your body. So you can over detox yourself to where you might feel a little flu-like, or just a little, like the beginning of the flu or something like that. So in theory, you're not really overdoing it, but you don't need to do it that much. But if you're comfortable and it's feeling good and you're progressing fine and the doctor is happy with what's going on and you have the time, the typical thing is you want a good 3 to 4 or 4 to 5 hour difference between the treatments. If you treated yourself now and then treat yourself in another hour, it might feel good, but you've already given your body the energy that it needs at that time. So if you can have a 4-hour break between sessions, you're starting fresh and you're working on the area again. So I wouldn't necessarily think that you're overdoing it. As you progress along, you might only do it twice a day, but it's pretty hard when it feels good.
Right, exactly. That's the thing, is that it feels very good.
Right.
And so yeah, I'm just trying to get as much benefit as I can, of course, because I want to get back on my feet as quick as I can. Sure,
absolutely.
Yeah.
And so I wouldn't say that if, again, given the spacing out between, do you need to go 30 minutes each time? But again, the question is, gosh, that feels good, and I got 30 minutes, so I want to feel good. You're not really overdoing it.
Right.
Now,
my body is very used to it because of having had the back issues for ages.
Right.
And so I've been using it, for 2 years.
Right.
So I haven't really felt any kind of detox effects or anything like that.
Then you're good.
So
I'd say you'd be all right.
Okay. Very good. Thanks a lot.
Thank you for calling. Bye-bye. And that is a very good question. People say, can I overdo it? Well, you don't need to overdo it. There's no reason to overdo it. The body only needs so much energy. But again, if it feels good, I guarantee you, if Dee Dee came to me and said, would you rub my back at morning, noon, and night? If it made her feel better and I had time to do it, and give her a little back rub on her shoulders or something like that, it feels good. And that's a good thing. Are you overdoing it? No, in most situations. Now, you don't want to put it, if you're running it all the way up on high or something like that. Now, again, high is different between the Soul and the Semi and the Max machine. So you don't need to go real high throughout the day. And the other thing, Deb, I would certainly remember and think about is when you do it, in order to best enhance the results that you're looking for would be to make sure you change the intensity. You're using the mat, so you want to change the intensity from session to session so your body does not get used to what it's receiving. If you put it on the same setting each time over a period of time where it still may feel good, you're really not getting the body can begin to slough off what it needs to use, how it needs to use it. So change those intensities and proceed as you wish or as you're doing. So hope that helps. Okay, question regarding EPM. I've heard vets say to treat during treatment, and I've heard wait until after treatment. My personal mare just got done with a 2-month treatment and it's completely healed. Are we supposed to wait? My theory is you don't want to MagnaWave during treatment because you don't want to stimulate the protozoa you're trying to kill. Thanks. Okay. Years ago, when I started, and we started working with veterinarians and people that were using these treatments, the recommendation at that time from the veterinarians was, let's treat the animal, then come back and MagnaWave. Once we've completed the treatment, they're either dormant or dead. We want to try to move them out of the system or return the muscle to the better form that we want. That type of situation. Over time, some veterinarians decided, let's treat at the same time so we maybe enhance the medication that we're giving, maybe get a little better metabolization into the body and can help the animal along in that situation. And many vets have kind of accepted that and worked into that. And so it's really up to, as you talk to your veterinarian, how they feel. You're not going to hurt anything. You're not going to make it worse if you're treating during the medication or during the medicinal period. So, but refer to your vet. Follow their lead. If they're not familiar with what we're doing, they very well may say, let's wait until after the medication we're using is finished, and then we go treat. It's quite that way when you're talking about if you have an animal that's receiving chemo. In the United States, a lot of the thoughts are, let's wait until after the chemo session. You go to other countries and they'll treat during the chemo because we don't want to enhance if an animal or a person becomes ill or a little more sick, if you will, a little more irritable because we're treating during the chemo. But that's in other countries, that's done a lot. So again, talk to your veterinarian, talk to your doctor, and get a very clear stance on how you feel about the situation. The nice thing about it is in some aspects you can treat, and if there's a little bit more irritability, just back off, stop, wait till, let it get assimilated into the body, let it complete the whole process, then treat. So to answer your question, once again, it's kind of a double-edged situation today. In the beginning, we always waited till the end of treatment for EPM, then we treated. Today, there are more and more people who are saying, let's treat during the medication process. And that's okay too, if everybody's on the same page as to what we're supplying. Again, a good oxygen, good blood flow, and all of that is really what we're after in those type situations. Northern Lights is with us. Suzanne's with us. Debbie, just remember to vary the, thanks. She'll remember to vary the intensity when she's treating her back. If you have a question, please put it in the chat box. I'd be happy to answer it. Put it in the YouTube box. Will the LZR help with hives, human food, hives, comma, human, ... food allergies and food allergies? Well, the LZR will certainly help with hives because it's going to help the blood flow to the area. The light's going to penetrate and get in there to those areas. If you're talking about on an animal, certainly remember to spread the hair right over the area that you're going to treat and go after it accordingly in that situation. If you're on a person, you want to be on the body if necessary. Some people may be leery about using the LZR on the body. What some people do is put like a piece of plastic wrap over the top, or like a plastic bag that you would put it into just to keep for cleanliness purposes and so forth, but you can put that right on the body. Treatment times, I got another question about treatment times. Someone asked a question about using the LZR on sciatic pain and how long and what the treatment regimen would be. The treatment regimen on a person is 1 to 2 minutes, typically in an area. So if you're treating sciatica and you're dealing with MagnaWave and the device, you might take the device and move it down the area of pain, move it every minute, and move it down around the hip, down the leg, and then come back and use the MagnaWave. Or MagnaWave first, get good blood flow, good oxygenation, then put that light on there for 1 minute or 2 if you want to. Hold it on the area. If it gets a little warm after 30 seconds, go ahead and move it, and then let it treat the next area. So that would be the situation there. With food allergies, that's a tough one. My wife's deathly allergic to cinnamon, and they're using cinnamon in so much more stuff today than they used to. It used to be cinnamon toast and and certainly as a thing, but now we're getting barbecue sauces with cinnamon. Many desserts have cinnamon, and we have to be very careful as to what she consumes, because she ingests cinnamon, and it's called the ambulance because it just flat closes her up. So we really have to be much more cautious today with that. Now, I can't imagine what we can do with the LZR to change a food allergy, because there's so much more to deal with the allergy in the body. Now, if it's something from the aspect of an allergy that's causing your breathing issues and nasal issues and that type of thing, of course, the light therapy or the MagnaWave therapy, the PEMF therapy to help clear everything clear, everything drained, it can be very beneficial for the relief aspect. Is it going to address the allergy? We're not doctors. I don't know if there's ever been a study using PEMF to basically change the body to resist a particular allergy or something like that. So that's a question, but certainly to use it to help keep the sinuses clear, which always are irritated with allergies quite often, those types of things. If it's a food allergy that comes into a rash on your body, then certainly a device that's going to help the blood flow to the area, help clear up the area and relieve it, there you go. But to address the allergy, no, I don't think so. That's a doctor question and what you're doing. But how the result of the ingestion or the allergy and how you approach to help mediate symptoms or effects on the body, then the LZR or the MagnaWave could find itself in a very favorable position to approach that and to provide some relief. Great question, Hazel. Thank you so much for asking. Let's see. Couple of questions from Brianna. Can I do a treatment on a horse's legs and then put back on track leg wraps after the body treatment on a horse? Most certainly. The back on track is basically copper filament or copper fabric, if you will, woven into the back on track devices, which does in many cases produce a little warmth and heat to the area. And so to do that after a treatment would be fine. You don't really want to wrap the leg with the back on track or whatever and then put the machine on it, because they're kind of fighting each other. The machine's trying to cool and the back on track's trying to warm. And so they're both trying to do a similar thing, but we don't need to fight. So put the back on track on after. Did that for years. I worked, what's his name? It'll come to me in a second. The gentleman, oh boy, I just had it, that brought back on track into the country. Bo Levander brought back on track into the country, and he and I worked together in Wellington for a long time when I was down here working the Wellington circuit myself. And and we would do that. I would even sell some back on track stuff, or I'd recommend back on track, but we would treat the animal, then use the back on track so it does its work over a number of hours after we've completed. Remember, we're improving oxygenation, improving blood flow, everything's good. So then you add a complementary item to that, like back on track, sweet deal. And you can certainly proceed in that type of situation. And then after her next question, after body treatment on a horse, can I place a static magnetic sheet on that horse? Of course. Static magnets, that's what were used in blankets for years before the Centurion systems and so forth. The only issue with a static blanket, Nikon used to make a lot of magnetic devices, and most of them were static magnets. And so they put the blanket on the horse and leave it on for 24 hours. And that would provide relaxation. That would help on a shallower surface to improve blood flow and all of that. It would take a long time. That's why they wear those blankets overnight and to try to get some value to the horse. So after a treatment, to use a static magnetic blanket, that'd be fine if that's what you want to do. You need to do that? Not necessarily. But if you've got a horse that's very high strung and likes the blanket and likes what it does, do it. You're just going a lot deeper and a lot faster with the results that you're looking for with the MagnaWave PEMF device. Good question, Brianna, and I hope that helps. Carly's with us. Joyce is with us this morning. Hello. So if you have a question, put it in there. If you'd like to talk to me, 502-599-9722, and I will promptly call you back. Little water there. Doing a lot of chatter this morning, so just want to kind of go there and get refreshed a little bit, just like we all do. So again, if you have a question, simply put it in the chat box, and I will certainly answer it. Let me see if there's something there. I'll stay as long as we have questions. If you're got what you wanted to have answered and you don't have any particular questions, not a problem. We'll just head on and let everybody get back to their day and have a good day and be resourceful in your use of the various therapies that you're using for your personal use or your clients, whatever the situation may be. Hello hi, Dolores from Wildwood, Alberta. Thank you, and thanks for being with us, Joyce. And again, so let me make sure I didn't miss something up here in the beginning. Okay, I do have a couple more things that, let's see, let me go down here. Here's the question: how often should a person with bag sciatic use the LZR session, and for how long a session? Sciatic, as I talked about just a couple minutes ago, the LZR treatment times are a minute. In most cases, you can do 2 minutes, but you want to put it on and then move it and do it, kind of work down the leg and then come back and maybe repeat the process. But a minute to 2 minutes is the recommended, because the LZR only runs for a minute. So, and then it shuts itself off. So that's the preferred time. Now, if you're an athlete and you're working out all the time and you've got a lot of not tense, but a lot of dense muscle content and so forth, you may need 3 minutes with the LZR. And you may need to move it just shorter areas to get the good penetration that you want to, but you don't have to go a long time, because that LZR with its 12.5 power wattage and it goes deep and it really does a nice job as you're using it for those types of situations. Let me go here. I'd like to know what informational videos have been the best sellers for your human clients. This would be someone who knows nothing of PEMF but needs a powerful, short information introduction. And we got a bunch of those. There's a bunch of different videos that I've done over the years. Elaine's done. We've done interviews with people. We have a new thing that we're using with and I was just talking about this morning with Elaine. Some practitioners are using the brain tap. So they're there and they're treating a horse, and they'll set one of their client in a chair, put the brain tap on them, and let Dr. Patrick Porter do an explanation of what PEMF is doing to them, to their animals, and while they're getting some nice eye and light treatment and relaxation, so they really get the understanding of what PEMF does, what the brain tap does, and how it can apply. So there are several. If you want to know, send a question to Chris or to Chris at MagnaWave PEMF, and there's two Chris's. There's Chris Burkhart and Chris, and they can find the videos that people are requesting the most or having the most views that people can use. And you can certainly pull this up on your phone, save the link from YouTube, put it in your notes on your phone, and if you're with somebody, say, you want to know what it does here? This is an interview that Pat did, or this is an interview with so-and-so, and it kind of explains what happens with the PEMF, and they can watch that for a minute or 2 minutes, and again, get a better understanding, get a testimonial. If it's a testimonial video, it's not me, because somebody may think, well, he's just trying to sell machines. Well, of course, we're in the business to sell machines and to help people help their animals, but at the same time, someone who's watching a testimonial by a third party, then that works out a lot better, and they feel like that person's telling the truth. I mean, nobody wants to go do a video and not tell the truth or whatever's going on. So that's a good way of having a look at that. Let's see. What holiday or monthly specials do you offer? That's a good thing. Elaine will probably can get some of that. Maybe we can get some information from Elaine and post it to the various sites that we have. My husband did this on a table saw. I'm looking at a picture where a person put their hands into a table saw. I once in a previous life stuck my hand into a printing press and chewed up my fingers pretty well. Since it's been magnawaving and icing every few hours since the initial bleeding stopped. I'm not very familiar with HydroWave, so I'm just wondering if anyone could provide some info or advice on how it could be beneficial for pain relief and wound care. Well, the HydroWave certainly helps with wound, just helps clean the area. Any type of Neosporin, if you use something like that to help topically clean the area and keep it in a good sterile type situation, could be beneficial to any type of open wound or cut. And then the MagnaWave is certainly going to help propel the healing process and take away the inflammation that's causing the pain. And again, this person got their fingers cut up in a saw, and the MagnaWave is going to help the pain. The LZR, in addition to the MagnaWave, can also be beneficial to that type of situation. So let's see if there's anything else here. Does anyone MagnaWave after a dog has been spayed? Well, certainly the spaying procedure could be uncomfortable to the animal, and you want to make sure that everything heals properly and good blood flow and good oxygenation. So it's not a bad thing to do after a dog has been spayed, to just treat the area, treat the animal in general so they have good comfort. We want to be comfortable no matter what's happening. Everything is invasive when you're going to do these type situations, and different animals take it differently. It affects them differently. And so to treat after a situation like that is certainly not a situation that is a bad thing. Okay, we have another person at the door, would like to come in. Okay, let me come here and we'll get the voice call going up.
Oops.
Oh, it went away. Well, the question was, I'll try to call again. Do you have any research or experience successfully treating plantar fasciitis? The answer is yes. That the pain, certainly you get a stretching of the muscle in those areas, or you get inflammation and you have problems on the heel, the ankle, the bottom of the foot, and you need to, and treating it hung up accidentally. Okay, let me get him back on the phone.
Hello.
Hello, how are you?
Sorry about that.
No problem.
Did you get my question?
I did get your question. Plantar fasciitis, and we've had a lot of success with that. Again, it depends on how long they have had it, how severe it is, as to how quickly you might get the response that someone is looking for. But to treat the area with the butterfly, the paddle, something like that, can help reduce the inflammation, can help relieve the pain that they're experiencing. But you understand, they're going to get right up and start walking, and they're going to do things to continually irritate the area. So it's going to take many treatments, or could take several treatments, to get ahead of the pain, and then additional treatments to get way ahead of the pain to where they have some comfort for a week or 2 weeks or whatever. In many cases, you get rid of the situation if it's not anatomically caused or anatomically induced, that it can maybe not be an issue any longer. But some people are just predisposed to that type of condition. So to treat, and it's as simple as putting the foot on a paddle, putting the butterfly ring, a butterfly loop around it, and treating at a setting that is comfortable. When you're dealing with the foot, you can go a little higher, certainly, in the intensity that you're delivering, which will help fight that inflammation more rapidly and maybe provide some comfort from that type application.
So if it has been a while, I'm not sure if it's anatomically caused, but what would be the protocol then to relieve some of the pain?
I just put it on there and treat it for 10 or 15 minutes, see how it feels. When you're talking about a situation like that, it's much more difficult to get inflammation out of nerves and cartilage and connective tissue than it is soft tissue, muscle. And so the protocol would be, I would say, if you're treating someone with that, you'd rest their foot, maybe rest their heel inside the butterfly loop, not open, just kind of put it in there. And I would treat it I'd start at a moderate setting for, let's say, 10 minutes, see how it feels, and then maybe come back for an additional 10 minutes at a higher setting, kind of take it up to where if it, make sure it doesn't become uncomfortable to the recipient. But that would be what I would do. I would do it as often as you can. A lot of people say, well, I want to do it once a week. Well, they're going to walk on it for a week, and then they're going to come back and treat it again. So as soon as you finish, they're going to start stressing the area again. So to treat it as often as possible. If it's somebody that you're close to, that it's easy to do, I'd do it once or twice a day for 5 or 6 days, and then maybe do it once every other day or something like that, and see how it works and see how it plays out. We've had very good people get very good response with plantar fasciitis quickly. Other people, it takes longer, more intense application of the therapy.
Okay. I saw a lot of great response on migraines, but I wasn't sure on the protocol on that one. So I was treating on every other day, but I wasn't sure how long I'm supposed to be treating. I've only treated twice.
I would say if someone on a migraine, I would say if you have a migraine coming on, the sooner you treat, the better off you are. And the protocol would be 10 to 15 minute treatment on the back of the head would be a way to approach it, or put the large loop over the head on the shoulders and treat the entire skull area. Same thing for 10 or 15 minutes. And if it's coming, you might want to do it twice. You might want to do it in the morning and then again in the afternoon. But a lot of times you want to get it as soon as you feel it coming. And if you can treat twice every day or every other day, if it's something that is a chronic thing that it comes on and it's just gnawing at them for a couple of days, then certainly to treat it every day or every other day would be beneficial. Always remember, we've learned to treat the feet at the same time. So if you're treating the head for a headache or that type of situation, put the butterfly, the paddle, or put your feet in the middle of the large loop, turn it up as high as you can turn it, as just making sure that they're comfortable, but treat the feet. We kind of found that by accident years ago. We were treating for that, and somebody said, well, what about reflexology? And they treat the feet for migraines and headaches and that type of thing. Well, let's do that. Let's treat the feet and treat the head. And bingo, it just enhanced what we were doing.
That's helpful. Thank you very much.
You're welcome. Anything else?
No, that's about it for now.
Okay. Thank you. Thank you so much. Have a great day.
You too.
Bye-bye. Another great question. We go over these things a lot, but different people are here, and it just sometimes you hear it 3 or 4 times, but you don't hear it, and all of a sudden it clicks. But that's always important when we've learned that when you're treating headaches, things like that, treat the feet. Actually, from the reflexology standpoint, everything that, a reflexologist is going to show you all the areas on the feet and where it relates to the body. So it's almost like acupressure or acupuncture. You go to the feet, you treat the feet, and you treat the shoulder. Well, there's a part to the shoulder in the feet. And from a reflexologist's point of view and the way the reflexologist operates. So it's never a bad thing to approach the feet from that perspective. And those of you, if you're into acupuncture and the zones and the points, and that's the beautiful thing about this. If the point is here on the shoulder, well, you don't have to get exactly on the point. You put the butterfly on the shoulder, you're going to get the point. And so if you have something that you Googled, acupressure points for this or that, and you see the area, as long as your coil is on the area, it doesn't have to be exactly on the point like an acupuncturist will put the needle into it. I'm not debating or discussing why it wouldn't be better to have the needle in there and specifically do that exact point perfectly, that type of thing. There's a whole basis to that, and they practice that and they understand that. But from a novice's position, to be near the area, you can stimulate acupuncture points with needles, with cutting, with pressure, with EMF, with laser and light therapy, those types of things. So there's several different ways to manipulate these points that are beneficial for various areas of the body. And you can learn about that. We cover a lot of that in our training as well, and go into those types of areas as we go along. Okay, let's see if there's any other questions here. Thinking about buying another attachment for my MagnaWave Soul, either the paddle or the mat, human practitioner and canine. Which should I invest in first? Any recommendations? Well, if you're doing small animals, the mat is very beneficial. I mean, you can lay it down, a dog can lay on it, or a cat can lay on it in a heartbeat, cover the whole body, and just give them an opportunity to improve anything that's going on. With small animals, if you're dealing with dysplasia, then you might want the paddle, and because you're dealing with the exact spot and you want to get the intensity that you're looking for on the hip, or wherever they're having that situation. Whereas you put the mat on there, you're getting energy to it and you're doing it, but it's not as intense or not as pinpointed as the paddle. What you need to remember is that the paddles, for example, are true Tesla loops. They start in the beginning and it winds out much like a watch battery, and the coils are touching, and it makes a much more intense, much more power Gauss delivery going to the area. You put a big circle, you lose Gauss because it's just a big open circle. So you can still get the energy you're looking for, but maybe not as much energy as you get out of the paddle. So from a human practitioner side, I would think that the butterfly is so versatile. I mean, for years we didn't have a paddle. I had a butterfly and a large loop. And so the butterfly would do what a paddle would do. It's just not quite as strong. So however, you use the mat, and someone can lay on it. Someone can sit on the mat if you're dealing with prostate, incontinence, whatever the situation may be. An animal can lay right on that mat and treat their whole back or their hips, or any other type of situation. So, I might be, if you're just beginning to build out your attachment group, I maybe go for the mat at that point, and then you can kind of decide which way you want to go. So again, you have the butterfly, but it's not the Gauss delivery as the paddle, but it is very effective for what it's doing, and the mat will give you a larger surface area to work with and deal with as you're moving along. Great question that folks are asking. Let me see if there's any other questions that someone may have. Let's pop back over here to my question base. All right. Let's see. My mom just come. Let's see. I have a question about okay. Well, there are some questions. Can PEMF? John's asking the question. Let me. John will be right there. Let me make a comment. There's been several that have come on. All right. Cindy asked the question. Okay, John, let me go. I'm sorry, you guys, you're asking a bunch of questions. I want to get back from the beginning. What is the depth penetration of the LZR? Okay, here we go. The depth penetration of the LZR. Well, it's gosh, I looked at this. We have it. If it's not there, it will be there. I would say it's a few centimeters, couple centimeters that it will go down, and then you'll get some some ancillary, because if you can affect 2 centimeters, it's going to drift a little farther down to get some good effect from that participation. It is a strong enough light and one of the great uses for the LZR, if you're dealing with anxiety or depression, is to put it right on the forehead for 30 seconds to a minute, and the light will go into the bone, and you're slowing it down quite a bit, or restricting it quite a bit over the bone, but it really works well. So you have that brightness on your forehead, and then move it to each ear with no hair over it or anything like that for 15 seconds using the LZR on each ear and the forehead, and it really shows quick, effective use for anxiety and depression. So, but the depth of penetration, if you get right down to it, is a couple centimeters going in. Now, you put that on your shoulder, that's pretty deep. You put it on your buttocks or your back, you got. But most of the stuff is down the spinal column that we're dealing with, so it's very effective in those types of situations. Kathleen's talking about MagnaWave Conference in 2021. Tickets are available now, and you save about $100 if you buy before the first of the year. So if you want to take a look at that, it's go to the Facebook page or go to the website. It's on there. Let's see. John points out we're locked down again in the UK. I have a new manager for a salon therapy room that I own, and she's very interested in the MagnaWave and pushing it in local gyms, golf clubs, etc. Can I get her on the online training? Okay, that can probably be worked out, John, in some fashion. You want to probably send an email to Cameron at magnawavemf.com or Aaron, and then we can work you through that and help you get that situated. It's nice to be able to participate today, Debbie. Thank you. She's usually on the road on Tuesdays. Cindy asks, would the LZR help with facial rosacea, acne-like sores? Rosacea, acne-like sores. Well, for sure, because you're going to go in and you're going to help the flow to the area. You're going to get the light. The light is, get outside and get the vitamin D to your skin. All that can be beneficial. You want to make sure the times are there. There is a book that you received with your LZR that kind of really gives a lot of background on different areas or various things to do. If you have a specific question like this one, in which I can address, but Dr. Turchin would really be the one for me to reach out to get the exact answer on that. But MagnaWave, the LZR therapy could be very beneficial for those types of situations. Let's see. How would you treat water on the knee on human? I would simply treat. If they have a buildup of fluid on the knee, we want to massage that area. The machine can do that very effectively. The LZR could benefit that, but just put it on and treat it. 10 minutes using the butterfly, or maybe using the large loop, whatever. Make sure they're comfortable, but simply treat it and work the fluids, hopefully work the fluids out of the area and help things improve. Let's see. Suggestions for treating a 79-year-old with long-term neuropathy in the feet. He was also recently diagnosed with lymphoma and is not undergoing chemo at this time. Again, you want to talk with the doctor about the lymphoma and how it may be approached. And you always want to do that when you're talking about those types of situations. Let the doctors advise you on what to do and how to approach it. You could reach out to Hope for Cancer. There's various places you can reach out to get some thoughts on how to initially approach that type of situation. But let's see, with long-term neuropathy in his feet, the challenge there, and you've heard me say this before, it depends how long it's been there, what the severity is. I had what my doctor told me was age-related neuropathy in my feet, and it really, I can remember driving a couple of years ago in my RV, and it just, my feet just burned. And what I did is I treated myself every day, twice a day, just simply put my feet in the large loop and turn the machine on, treat it. Then I began using the B2 machine, and I'd use the pad in my bed, and I'd put my feet on the pad when I slept, when I rested in the evening, and I let that pad work. And it works at 500 Gauss, not 35 Gauss, not 50 Gauss. 500 Gauss is what it's delivering. You can feel it as it tingles, as it works. And I basically have that in control to where it's not bothering me at all. Now, I've not had very severe, I mean, it was pretty severe to me, but some people have had it for years and years. It's hard. I mean, you don't know how far along the nerves how much the nerves have deteriorated and what has gone on there. So if it's really a nerve problem that they're not functioning properly, and so they've got pain, it's been shown through the NASA study to have the ability to regenerate some nerve tissue and regenerate some nerve. But to say that it's going to take a nerve that's fried and turn it around and take away the pain, we don't know that, and we can't say that. But certainly continual treatments is something to do. I had a guy in Florida, 7 or 8, 9 years ago, and he really had severe neuropathy to where he really had to think about walking. because he didn't have much feeling in his feet. He looked fine, he walked fine, but he just had to be very conscious of his movement because he really didn't have as much feeling in his feet. I treated him 2 or 3 times and he said, I'm not getting anything. And so he didn't want to do it every day for 30 days or twice a day. I understand. I mean, people are going to do what they're accustomed to and what works, but the severity and the length of time that someone has had it becomes part of the issue when dealing with that type of situation. Let's see. Can MagnaWave PEMF make a migraine worse? I know people who suffer from them, but sometimes it might be caused too much blood flow. Typically, pain is a result of inflammation. Pain and inflammation quite often restricts blood flow. I can't say, depending on the individual. I mean, again, that's a doctor question as to how they're treating it, what they're giving them for their migraines, and what they're doing. You know, that's not a situation that we would approach. But to me, it just seems like to put it on and use it would do nothing but help the blood flow, the oxygenation, and potentially make someone feel better. I don't really seeing it make someone feel worse, but everybody's different, and it could just be, you know, the nerve that's being affected. You know, sometimes people get and I've told this story before. When I treat my first racing jockeys, they'd come to me, my low back is killing me, so I'd treat their low back. They'd come back tomorrow and they'd say, now my shoulders are killing me. Their shoulders were bothering them originally, but their back was bothering them more. And you could get that with a headache. If you got blood restrictions and you got the inflammation causing the migraine or what's going on, and you treat it a little bit, and all of a sudden, maybe they're feeling better, but now it's hurting a little more because there's something else going on, needing additional treatment time or whatever. So that's the way to have a look at that, and particularly look at the use of the device. Let's see, I have a Julian Duo. One unit seems to be getting stronger than the other. Call Lori. Okay, you'd want to talk to the office about that, Lori, and we'll take a look at that. Now, my question would be, are you using one side more than the other? If you're using one side and you're using, because it is an actual electrode that can wear, and so when the electrodes are further apart, they're a little stronger. So if you're using one side of the Duo regularly and not the other side, the side you're using is going to break in more and be potentially feel a little stronger. And but if it's something that is much different than that, then you want to talk to the office and they can make sure you're squared away on that. So a good point on the Julian Duo is to today, if you're using one, you don't always use both sides of the Duo. Okay, and so today I'm using it, and the next treatment I'm using the other side, or tomorrow I'm using the other side until I'm using both sides at the same time, would be the thing to do. But Lori, I would call the office, and we will take your question, ask for, look at this. Hello, I need to treat myself, but call the office, and we'll take care of that for you. And call Lee at the office, and she will be able to help you out. 502-749-7868 or 833-MagnaWave, and get the office. Ask for Lee. Explain to her what's going on. She'll check it out and get back to you. If we need to look at it further, we will certainly do that. Kathy asked the question, my mom just came home from being in the hospital. They found that she has 2 blood vessels in the base of her brain that are narrowing. She has been placed on Plavix. I am waiting to hear back from the doctor on treating my mom. I have not worked with someone yet on a blood thinner. Is this something that would be contraindicated? The doctor will deal with you with that on the contraindication. We do improve the blood flow. If there is no open bleeding, we've treated people before that are on blood thinners for pain in their muscles and that type of thing. We don't really make the blood any thinner than what it is. So we're not going to enhance that once it's in the system and once it's doing its job. But you certainly want to clear that with the doctor. And certainly the vessels are narrowing, so they want the blood thinner to flow there more easily. And that's what we're dealing with, is improving blood flow. I don't know that I would be treating the neck area or where that situation is. I don't know why you wouldn't, but you wouldn't. I would be treating maybe the torso to just make sure all good blood flow is good. And because quite often when blood vessels, blood cells go into your eyes in small areas, they fold over. Here they are moving along as a circle. Well, they go into that area and they fold flat, and then they move into those there, and so they can, blood vessels or blood cells are very when they're in good shape, which we like to help keep them be in good shape. They can conflict, and not conflict, but move themselves to be able to go where they need to go. And so certainly talking with the doctor, and you're waiting to hear from the doctor, so it's a great situation is to get that answer, and maybe we can talk about it later to find out. John asked the questions. The other companies I have a machine from say to use the loop to treat between the legs to bring blood flow there for coming on migraine. I mentioned before, did you ever try it? So let me read that again. I have a machine. John's got a machine from 2 different companies. He bought a machine from another company originally, then he came over to use our equipment, which is great, and used it between the legs to bring the blood flow there for coming on migraine. Well, I guess that's kind of like treating the feet, but to put the loop between the legs, you got a lot of muscle mass, a lot of flow into your legs. And so to treat that area, we know, and we've seen dark field microscopy of when you have blood cells that are clubbed up, when it's called ROLU. The blood cells are stacked up like this, and they can only get oxygen here. We don't want that. We want the blood cells separated so they're flowing freely, around the body. And so when you think about, it's not a bad idea, when you think about treating that, to treat the buttocks and the legs, or put the loop between the legs to get good blood flow down the leg, up the leg, to go up the back, into the head, to relieve the migraine, not a bad idea at all. I'm sure it's very viable. Just treating the body. When they did the and we have it on the website, the blood video, but they took a woman and they treated her. They pricked her finger and they looked at the blood, and they had ROLU, where the oxygen could only get in here, not on the top. And they treated her for 15 minutes on her hips. Came back, pricked her finger, looked at the blood. It was flowing very smoothly. ROLU was gone. In other words, the cells were moving very freely, moving down the road in the vessel, and everything was good. So any place you do that is not a bad thing for a migraine. The device, and we've done this for years, somebody who has depression and we're treating their back, all of a sudden they're feeling better. Their sense of well-being is improved, and we've not treated their head or anything like that. We're just treating their body for better oxygenation, better blood flow, and they feel it's better sense of well-being because we're putting good blood everywhere in the body. That's much like it takes. You treat somebody and you can get the results of that treat for up to 2 or 3 days. Same thing in an animal. You can get that improved blood flow stays for a while before then it begins to deteriorate again. So good point, John. Great. I'm glad you bring it up. How many folks had success treating torn rotator cuff? Any ideas to help relieve the pain? Yes. Put it on there and treat it. I've done something to my rotator cuff. Doesn't bother me every day. And I'm one of these, I keep saying to myself, I need to go to my doctor, have him take a look at it. Doesn't bother me every day, but all of a sudden I'll do something and it doesn't, I don't know, I'll go out and work in the yard, work on the RV, go do something, and all of a sudden I'm sitting in the chair that evening and man, my shoulder is really killing me. And I put the coil on there and I treat it for 10 or 15 minutes and it's better. The best thing to do if I'm going to go outside would have the organization to treat myself, then go outside, then come in and treat myself to try to mitigate it. If it's torn, we can help it heal. We can help the body better heal itself. But if it's torn to the point that it needs to be repaired, you can simply keep the pain at bay, the inflammation at bay. And so by treating the area, just put it on there and treat it, and you'll help it. And hopefully until it either gets to the point that you got to repair it, or you maybe kind of leave it alone. And mine does that. For when I first did it, whatever I did, when I first started noticing this, it was there for days. And I was all of a sudden, I need to treat this. So I started treating it. I treated it every day, morning and night, whatever. Then it kind of wasn't a problem. So I forget about it. And then all of a sudden, ooh, it's back. I did something to stress it a little bit. And here it is, it's back. So that's what I would look for there with the rotator cuff. And how to treat. Just simply treat the area. Now, sometimes it refers pain. I mean, it's here in your shoulder, and boy, it goes all the way down your shoulder. It comes over into your collarbone area. You might want to treat the whole area here. So you as the fascia moves the inflammation into the connective tissue, you want to get the whole area. If it's right here, you can treat right there, but you want to again make sure you treat the whole area of the body. Let's see. Hope that helps. Many folks had success. Okay, so Aaron's kind of replying there. Can you get early bird tickets for MagnaCog 2021? You can get. Oh, that yeah. I had my eyes fixed, and I'm not wearing my glasses anymore. But still, it's just a little better if I just come up a little bit. I can read the questions a little clearer. Let's see. I have the XL double loop. Since I received it, I have felt little shocks like static now and then. People have felt it during the treatment as well, and horses only tolerates real low setting. Is this normal for this attachment, or is it a defect? No, it's normal for the attachment. Static is an issue. When you have all the atmosphere around you, you can cause some static electricity. Depends if there's any sweating or anything like that going on with the animal. What's happening is with the large loops, I mean, they're big loops, you're stimulating a lot of tissue. And so you're causing a pulsating in a huge area. You're not going to be able to turn that as high as you will the paddle, or as high as you will the butterfly. So you won't be able to do that. So to run it on a lower setting is fine. And you'll have to do that to get that. Also, muscle density. Once in a while, you'll have a situation, you're going on click, 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 and you may feel that, well, that's the static or whatever it is. That's density, that's moisture in the air, that's resistance. These devices work on resistance. I mean, we're putting a signal into the body, resistance occurs, there's muscle movement. And so you're having that, and that can cause the signals to become a little irregular. Click, 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 click. You can get that, and that's not a problem. And but in terms of the large loop and not being able to turn it as high, that is the case. You won't be able to do that, to turn it as high. And you can learn that with the large loop that I used to use. I'd use the loop, and then you put the butterfly on, and I found that, number one, I could be much more see where the sensitivity was easier with the butterfly. With the large loop, I'd be pulsing the whole area. The large loop's pulsing this big of an area on a horse. Then I'd come back and put the butterfly on it, which is smaller, and I'd find that I'm not pulsing. If I move it over here, I'm not pulsing. I come back here, I'm pulsing. That's where the sensitivity is. So again, when you use those big, large loops like that, you're going to stimulate more tissue. You're not going to be able to turn it as high, and you're going to see more movement at that point in time. The animal will tell you, I don't want it any higher. I'm comfortable right here. So low is good when you're using those large loops. Let's see, XL double large loops. John points out, just for your info, the other machine I've had since 2017, I've not used it for a total of 500 hours yet. It's been sent back to the States once, and it's had a fan replaced twice by an electrician here already. Would you advise people to stick with MagnaWave? Of course. Now, but everybody has issues. We have, manufacturer comes out with a new model of a machine, and they change things, and all of a sudden, oops, we're having problems with this machine, and they turn out and they find out it's a resistor over here on the new controller that they have over there, and things take time to work out. But we try to make sure to stand behind our equipment and fix it if you have a problem, and we are having one today, as a matter of fact. We talked about it this morning. There were some electronic switches that were made for one of our new models, and we had two different manufacturers. The factory had two different manufacturers making these switches, and one manufacturer did a better job than the other manufacturer, and so we've quit using the switches from the one manufacturer. They've quit using those and until they get them fixed and switching over. But you don't know that because, somebody says their switches are good and it's not going to be a problem, then they are a problem. We call the factory and we've got to fix this. And so they fix it. But certainly my passion is to make sure that you have the devices you want and they work for you. And we will make sure that they do and take care of any issue that you may have. So John, thanks for sharing that. Okay, so there's another question there. We're over time, so need to head on so you all can get about your day. And I've got some things that I need to get to as well. So I want to thank you for being with me. Those of you on CastBox, I want to thank you for joining us today. And we'll be back here next Tuesday to answer more questions and get more in depth about MagnaWave, the devices, and anything you want to know. So thank you for being with me. Wave on to better health and have a great day. Thank you. Bye-bye.